Hello and welcome to this review of multiple sclerosis for the FNP. So, what is multiple sclerosis? Well, it's a demylination disorder, which means that first off, the myelin is what allows signals to be sent from the brain to the periphery. It allows them to be sent quickly so that when a message is sent, it can jump from here to here to here. Now what happens when there is no myelin is it has to go touch every single piece of the nerve, which is not fast or helpful. In some cases, the signal might not ever get there if there's no myelin. So when the demyelination happens, you have antibodies coming and unraveling the myelin, exposing the nerve fiber. This is an autoimmune disorder of note, and because it's affecting the myelin, we know that this is going to be more of a peripheral nervous system presentation. It's not going to be in the brain or the spinal cord. So who gets MS? Well, it's going to be your 20 to 40-year-old European female. It's going to be someone who likely already has an autoimmune disorder but doesn't have to. The most common ones are going to be those thyroid disorders or those type 1 diabetics. And when it presents, it's going to come with some pretty vague complaints. So it is going to be one of those harder to diagnose conditions. You're going to have numbness and tingling in the periphery. Some cognitive dysfunction or depression, dizziness may be noted. Most patients are going to have difficulties with vision. They either are going to be seeing double, they might have trouble seeing out of one eye, they might have nystagmus, which means your eye is moving back and forth very quickly, and difficulty with walking is going to be pretty common. You want to be aware of possible bladder or bowel dysfunction that a patient might not want to disclose to you, but if they're unable to void, that is an emergency, so keep that in mind. A mnemonic to help you remember that would be dyskinesia, so having trouble walking, ataxia, having trouble saying words, nystagmus, and all those eye symptoms, intentional tremor, scanning speech, and hypotonia of the muscles. So that's going to be Danish. The disease progression is going to follow in 80% of patients a relapsing and remitting pattern, meaning that they're going to have the initial acute outbreak, acute condition, followed by a couple of days of really terrible days, and then it's going to go away. Sometimes the acute event is triggered by something like a viral infection. And then you're also going to have 20% who are going to have the primary progressive, which just means they have the weakness, it doesn't go away, and it just keeps going. So how are we going to treat this? Well, really, the answer is in primary care, we're not treating this. It should go to a neurologist. However, if you come across these meds, you should probably know them. We're going to be looking for a high-dose prednisone in those relapsing, remitting patients, especially early on. We're going to look for a high-dose prednisone, and then they're likely on some kind of immunotherapy, A or B. And continuing with the treatment, we want to just kind of think of how this patient is going to look. So they're young, they want to do stuff, but they've got some muscle weakness. How can we help them with that? So we're going to encourage them to get care outside of our office. And we want to have a really good team of professionals surrounding this patient to treat the symptoms that might come up. That includes physical therapy, occupational therapy, likely a counselor, and depending on what other things come up, we might want them to see a urologist or a GI doctor. We just really want the best care for this patient, and so that they can have a happy, healthy life like this woman is running the marathon. And then here's a list of treatments. Not that you're going to be giving these, but you do need to know for your boards exam and also just in general treating patients. You want to have a good understanding of when they're telling you they're on, say, metraxazone. You want to kind of know what that is, right? So here's the list of all medications, not exhaustive, but the most common medications for MS. Okay, and that concludes our MS talk. I hope that kind of brought things into perspective for you, and talk to you later.